Okay, there we are being recorded. So thank you, everybody. This is the Chosen Healthcare Training call. And at the very end of the call, I will give a password and maybe one in the middle so that we can, I know that those of you who are going to listen to it can send me the passwords, and I know you've received the training. Most of the benefit counselors are familiar with Chosen that are helping with it because they assisted last year, but we do have some new benefit counselors, so we want to be sure everybody understands about this group. And Mike McCary is the opener on this call and on this group, and so he's going to share first since he has a limited amount of time to be on this call. And I know all of you have received the Rules of the Road training, so remember to send me those passwords too. Mike, you're on.
Okay. Well, good morning, everybody. For those of you that worked this group in the last year or 2 years, thank you for being here again. For those of you that are new, I think you'll find this a nice group to work with, good customers, and I think you'll enjoy working with our office as well as the broker on this account. Chosen Healthcare has a variety of locations around the country, as well as Texas and mostly in the Midwest, but they have locations in Texas as well. It's a core enrollment, as Andrea will walk you through everything today. I've only got a few minutes because I've got folks coming to my office this morning for meeting 3 people. So I've got about 15 minutes, and I figured I'd cover everything that I'd like to cover here on the front end. So it's going to sound a little bit out of order. I apologize for that, but there's a couple of things that I wanted you to know. Number one, we've worked with this broker for, I want to say, going on 12 years. I've been in the business for 13, and I met Carrie Gruenbaum a little after a year, and we wrote our first group together, believe it or not, 5,380 lives out in California, Nevada, and Arizona, and we did a great job for him. Since that time, I very freely offer this. I've written more business with Carrie than I have with probably any other 3 brokers that we work with. So our relationship is based on trust, and it's not just with me, but it's with what we do. We, as Andrea, benefit counselors, everybody involved, the home office, because Colonial does a really good job. So the thing that I'm going to open with, and I'm going to ask Andrea, because I won't be on the call during the close, to close with, is to remember that our job is to fulfill our complete responsibility to the client, for the broker, and for Colonial, and ourselves, and our families. That includes that we fully and wholeheartedly represent all of the benefits, that we're here to educate the employees and collect their decisions about medical, dental, vision, et cetera, all of the core benefits, as well as talk to them about the Colonial Life benefits. Now, naturally, we wish that every employee would buy a Colonial Life benefit, but that doesn't happen to be the case. Our job is not to push them. Our job is to educate them and help them understand where our solutions can help fulfill their needs. But at no time do we want to turn that employee's experience into one where they feel like somebody's pushing them. And then they end up going to HR. And HR ends up calling the broker and saying, hey, these people are being kind of pushy. We just don't do that here. And that's why we've been able to write so much business with Carrie. Now, Carrie's a big broker. He's got over 800 groups in his book of business. And I mentioned we had a training call this morning 2 hours ago on another 1,225 life case that Carrie brought us. That one's brand new. It's primarily based in Texas, and they have their corporate offices in New York. That same owner is purchasing more homes. I understand that Chosen is in an expansion mode as well. So as long as we mind our P's and Q's, as long as we do everything that we advertise, which is to be a good benefit counseling crew, we'll get more business together out of Carrie, and word spreads, and then we'll get it from other brokers as well. So we rely on you, the folks in the field, to execute our promises properly. So we have a happy client, so we have a happy broker, and then we perpetuate this nice referral string of cases that Carrie gives us every year. So let me move on to a couple of more tactical things. So the meetings are mandatory. We need you to be, let me clear my throat real quick, hold on. It's been a little foggy and moist out in California, so my sinuses are draining some, I apologize. So we've got mandatory meetings set up, and one of the primary reasons that we set up mandatory meetings, and I need all of you to be able to echo this to employees and to facility managers, et cetera. The primary reason is that education is important. Secondary, but probably just as important, is the fact that the ACA rules, the Affordable Care Act rules, dictate that employers, if they're going to offer benefits, are supposed to offer affordable, according to the law, not somebody else's feeling of whether it's affordable or not, but actual Affordable Care Act, affordable benefits. And that means that the benefits can't cost more than 9.66% of the employee's paycheck. Okay, whether you look at it as an annual basis or a monthly basis, doesn't make a difference. If you break it down, that's the factor. So Chosen does offer, according to the law, affordable benefits. Now here's what happens and why this education is important. Employees can not enroll in their employer's offered plan, and they can go to the exchange, and when they fill out questionnaires at the exchange, the excuse me, you can tell I'm working from home this morning, and that just got revealed. The employer is supposed to offer affordable plans, and then if the employee goes to the exchanges, then there are questions, and the employee is asked if the employer offered plans, because the employee, because they're not educated, they don't really get it so much, they are going to ask for a subsidy. And so the laws are, if the employer offers an affordable, according to the law, plan, no subsidy is available for the employees. They can still enroll in the exchange, but no subsidy is available. So it's important that the employees understand that it's not whether the employee thinks it's affordable or not, but rather the definition of the affordable plan that is offered by the ACA. That's the definition that needs to be answered. So part of the education that the broker and employer want all of you to convey to employees, whether they're enrolling or not, is just give them a nice review of the fact that their employer does offer affordable plans, that they meet the ACA guidelines, whether the employee thinks they're affordable or not, and yes, they can enroll in the exchange if they wanted to, but because the guidelines are being met by Chosen, there will be no subsidy available, okay? So it's really important that you do that. Speaking of mandatory meetings, this week we held a facility manager training call for Chosen facility managers. So HR was on there as well as all of the managers. It was not a benefits meeting. It was a logistics meeting about holding open enrollment. So the things that I emphasized were that affordable benefits, an ACA that I just conveyed to you. The second thing was the fact that these are mandatory meetings for all benefit eligible employees. The employee is required to provide a signature or waiver if they're going to waive. We've worked with this group before, and yeah, some locations, some employees are like, yeah, I enrolled in this, or I just don't want to. And so I reviewed all of that with the managers. It was not pervasive, so I don't want to scare you. It was not pervasive, but it's like, look, this is what we do every day. So we're used to employees feeling like it's not their rules. It's it's not their boss's rules. It's whatever they want to do. And when it comes to benefits and complying with the law, that's not necessarily true. So we have full support from HR and from the facility managers. I pled and begged and said, please help us to traffic the employees to the benefit counselors in a timely fashion. I talked with them about call center would be available, but only after you have left your facility. So you'll be leaving them with a call center flyer. Once you leave, it'll have the call center number for any employees who did not take care of business while you were there. Next thing I want you to know is there are 3 different plan pricing structures. Andrea is going to walk you through that. I'm just going to mention 1 or 2 things here about it. There's BC2, BC3, and then there's Texas. So BCC2 is the premium. It's the majority of them. It's the premium schedule where the majority of the employees are going to be living or be charged. BCC3 is about 50 people. They're regional directors and executives, etc. So there's not that many folks on it. And then there's Texas, because it's in Texas, they've got their own carriers and everything else. It's got separate plans. So that's the way it's structured. What I need all of you to know is that for all 3 of those areas, the premium rate for employee is lower than it was last year. I mean, it's $49.79 a paycheck, and that's biweekly.
And this is for the lowest cost plan, not all plans, just the lowest cost plan.
That's correct. So there's 3 plans. This is for the HSA plan, and it's for the lowest cost plan. It is also on the employee plus child coverage that there was also a rate reduction from last year. So this is because the employer ponied up more dollars. Need you to convey that to the employees. Okay, that's a nice culture enriching communication that you can provide. You can reinforce too that you just can't get medical coverage for $49.75 a paycheck. Additionally, that plan is the HSA plan. So yes, it has higher deductibles than other plans, but $49.50, there are a lot of things that they can do with an HSA plan. Namely, they can open up a health savings account if they're participating in the HSA plan. And then Andrea is going to show you during the call a little a little information piece that will convey to the employee all of the things that can be paid for with money that the employee puts aside in their health savings account. So again, I know you all know this, but I'm going to say it real quickly. A health savings account is just like an IRA or 401k. The money comes out of the employee's paycheck if they decide to open a health savings account. Obviously, they have to be participating in an HSA-approved major medical plan. They can take out $10, $20, $30, whatever they want per paycheck out of their paycheck on a pre-tax basis. So if they take out 20 bucks, it's like taking out 25 because they're not paying $5 in state, local, and federal taxes. That money sits in their health savings account. They will be given a card or sometimes checks. I don't know how it's working here. I don't think he told us. And they can write a check for or use their debit card to access that health savings account money to pay for things like deductibles and co-pays. Okay, now also a health savings account is money that belongs to the employee. So at the end of the plan year, any money that they did not use for health related expenses, it rolls over just like a savings account or an IRA account. If you don't take it out, it rolls over, it stays with the employee. If the employee leaves the employment of its current employer, in this case Chosen, then that account remains with the employee. So they don't lose anything. It's a savings account. And they don't have to use that money every year on health-related issues. They can put it in as a savings account because it's tax-free. It's like an IRA. It builds faster because it's tax-free, because with dollars they didn't pay taxes on. So make sure and convey those positive features about HSA to the employees. So, all right, we've hit HSA rates, HSA plans, mandatory meetings. We've hit the different levels of premiums. We've covered the deductible. I'm at my break point because I've got this meeting that's going to start in 10 minutes, and people are somebody already arrived. So I want to thank all of you for working our plan. The last thing I want to convey to you, as I did in our first meeting this morning with mostly Texas benefit counselors, is here at my office we have a very simple way that we function, and that is we work in a no surprises environment. We work closely with our brokers, and we put everything on the table. If something goes right, we tell them. If something goes wrong, we tell them, because that way we can get to solutions quickly. We're all humans. We'd like to be perfect, but we're not. If we make a mistake, the way we work here is we don't beat the snot out of people that make a mistake, but rather we praise them if you make a mistake and call us quickly so we can work on a solution together. So please hear that and hear it and accept it for as fact about the way we function. If something goes wrong, please let us know. Also, if you're not getting the cooperation from a facility, or facility manager, if they're not being helpful, let us know. Then we can go to the broker and the HR director, and we can ask for assistance to try to traffic employees and get things done a little bit better. Again, I'm only saying that because we're here to help. I'm not saying it because I expect it to happen. So don't go to the dark place. Okay. Andrea, I'm going to hand this over to you. I've got to hang up on the call this morning. Andrea, if you have a question that you need me to just text me. Text me. I'll have my phone with me. So I want to thank all of you again. I'm going to say adios. So have a good enrollment, and we'll be in touch.
Well, thanks, Mike. And thank you, everybody, for being on the call. I'm going to give the first password. The first password is Labor Day. So those that listen to the recording, you'll have to email me passwords. And let's see, let's continue on. Like Mike said, we're going to touch on some of what he said later. The database is almost the same as it was last year because they did not change plans. But so the password schema is the same for the account ID, employee's last name and the last four social, and then for the login, and then password, first four, last name, last four, social. So all that should be in there. The locations are still the same. There's been Capitol Village used to be called Highland HCC or something like that, but now it's called Capitol Village. The one that was Willow, Fox Lane is now just Willow. So but these numbers are still the same numbers for, the location number are still the same. So they still have the same locations. They didn't add any additional yet. They are working on doing it now. Here it is, Fox Ridge. I left the Fox Ridge in there since we're familiar with it, but I think on everything that you see it'll just say Willow. And they do have the Corp location in Greenfield, and they have a few employees at the Corp location in St. Louis, and that one they never gave it a number. It's just called St. Louis. This database is ready. There's just a couple of little things I still have to add to it, and then I'll enable it for download. And I will, I think I've sent to everybody. I think there's been an update on the benefit booklet, so I'll send the updated benefit booklet out. If I make any additional changes to the enrollment guide, I'll send the enrollment guide out as well. And remember, Mike is, he's very adamant that everybody watch his Rules of the Road training. Some of you may have watched it last year, but it's also always a good refresher on, a good benefit counselor etiquette and behavior. He, brings up a lot of good points there. And maintain a professional demeanor. Please don't talk on the phone or snack or smoke or eat in front of employees. Dress code is business casual. but we want them to feel welcome and not like they're interrupting us or anything like that. Mike did say that we have mandatory one-on-ones with all full-time employees. With this group, though, have plenty of paper and ink. We did discover last year that they like especially the various location managers, they like to have a set of the election forms of the employees that sit with us. Mike touched on this already. One of the reasons why at first they were thinking that this was just going to be an enrollment, a passive enrollment. We would just see interested employees, but then they recalled about the Affordable Care Act and realized that to CYA, cover themselves, that each year they have to have a electronic signature on file for every employee that they've been offered the medical plans. Because I think they did experience what Mike was talking about, where they got a letter from the IRS with questioning this, Joe Smith. He said that he wasn't offered a plan and he went for subsidies. So they need to have on file every year a signature that that met the Affordable Care Act guidelines of not more than 9.66% of an employee's salary to cover themselves. That those plans are offered, and they have to show proof. You can't just verbally say, "Oh yeah, we offered it to everybody." They have to have some kind of documentation, which our election form is that documentation. I'm hearing a little bit of background noise. If you could mute your phone so that we don't have all this clunking in the recording, that would be wonderful. You can unmute if you have any questions. I'm sure you all are familiar when you're in Harmony. You can go to the employee directory, you can select the location, and you can pull up the list of employees that are at that location. I would, at the end of your enrollment, pull up that list, or at the beginning of the enrollment, pull up that list so that you can, go through and be sure that you see all the full-time employees. They did include part-time employees in the census, and unfortunately, I don't think the list that you print out of the employee directory doesn't tell you who is part-time. If you go into the individual records, it will tell who is part-time. But you do need to, just be sure we get all the employees. And I did on the tracking sheet on the list with the locations and the phone numbers and the manager names, I did put how many full-time and how many part-time employees are at the location. And they only want us to sit with the full-time employees. Their current, I asked to try to get a clean spreadsheet of current offerings, and I did not receive it, so I did use what was in Harmony. It was probably going to be accurate 95% of the time, but there's always that small percentage that went direct to HR and didn't do it with our call center, or they made a qualifying life event change. So all their current existing benefits you will see under existing benefits. So they will not show on the election form. You'll have to look under existing benefits and see, oh, I see that you had the medical high option plan. Did you want to keep that or change plans? Or I see you had the dental, low option plan. Did you want to keep it or change plan? Vision and the voluntary life through Cigna, the voluntary short-term disability and long-term disability through Cigna. You will have to go under existing benefits. Each benefit that shows under existing benefits, you will have to ask if they want to keep it, and then add it again so that it shows on the election form properly. So I did not have everything roll through, because if I don't receive current information, it bites me. So I apologize that you have to add it again, but that's just what needs to be done. So and employees who don't sit with us and authorize their deductions won't be enrolled in benefits. So they are, making it mandatory that if they want to continue what they have, they can't just verbally say, I want to keep what I have. They need to sit with us and confirm the costs and everything. And just like last year, Cigna does want you to convey that they do have those value-added services, since all those benefits are through Cigna, that they have, healthy rewards, they have an identity theft program, they have a will preparation program, a secure travel. So they do want you know, just they're not as widely participated in as they would like. So just be sure to bring that up. Dependents were imported, but new dependents will